Good morning, everybody. As you know, today in the simulation lab, we're going to be practicing pelvic exams. So we need to go over just a few things before we go in, and I do a demonstration for you and you practice on the models. So today, at the end of this lesson, you should be able to interpret the guidelines for pelvic exam, describe normal pelvic anatomy, summarize the equipment needed to complete a pelvic exam, discuss the steps in the pelvic exam, and execute a pelvic exam on a model. To get us started here this morning, we're first going to discuss a case study. So our case study is a 48-year-old female, presents for her well checkup. She has not been on birth control since her 30s. She has 3 adult children. Her period has started to become irregular almost every other month. It can last for 1 to 6 days. There is no associated pain. She is sexually active and has not noticed any vaginal dryness. Her last pap smear was 6 years ago, and she is not sure if she's ever had an abnormal exam. She takes no medicine and no other relevant history. So let's think about this female that presents for her well woman checkup as we go through the next couple slides. So there are several agencies that disseminate guidelines for pelvic exams and pap smears, along with HPV testing. And two of the organizations that we're going to discuss today are the United States Preventative Services Task Force and the American Cancer Society. You can see their age range differs a little bit. The United States Preventative Services Task Force recommends screening women aged 21 to 65, and the American Cancer Society starts a little bit later at age 25 to age 65. The guidelines differ a little bit in several other ways. The United States Preventative Services Task Force recommends screening from age 21 to 29 with a PAP of every 3 years, no HPV testing within that time. And then above 30, they recommend a PAP every 3 years, co-testing every 5 years, or a primary HPV alone every 5. The American Cancer Society is a little different. We're screening a little bit later, right? 25 versus 21 years of age. And they recommend one of these methods. So primary HPV every 5 years, co-testing every 5 years, or a PAP every 3. I think in my practice, one of the ways that it's just easier to kind of remember all these guidelines is I do co-testing every 5 years. Post-hysterectomy, it is not recommended to have a pap smear. So we need to talk a little bit about what we're looking at on the external genitalia of the female as we start our pelvic exam prior to that pap smear. And I really just look at that vaginal area. I think about it in the terms of a face on a clock. Right? So that better helps me describe the locations of anything that I find that is abnormal. So I will typically start around the 12 o'clock area, and this is the mons pubis, and move along the outside of the vaginal tissue, along the labia of majora, and I'm looking for any redness, any swelling, any lesions, anything that looks abnormal to the skin. It should be nice and light pink and moist. After I look at the labia majora, I separate the labia of minora and examine this tissue. I'm now looking at the vestibule of the vagina. Inside, I can see the urethra, and I look at the condition of the urethra. Is there any erythema to this? I also examine the Skene's glands, which sit on the left and right side of the urethra. And if I come down a little more posteriorly, I look at the Bartholin glands on more of the posterior aspect of the vestibule of the vagina. Again, looking for all of those same things, any redness, erythema, lesions, discoloration of the skin. So once we ensure the exterior vaginal tissue is healthy, we can now move internally. Normal female anatomy internally that we're going to be examining is the vaginal canal. The cervix, we're going to feel suprapubically for any abnormalities of the uterus, and we're going to examine the right and left ovaries with our bimanual internal exam. We're going to watch here a video. It's really important that we gather and have our supplies ready to go before we have our female patients undress and prepare for their pelvic and pap smear.
So let's go over the equipment that needs to be gathered prior to completing a pelvic exam and a pap smear on our female patients. The first thing you will need is a way to gather vaginal secretions to test for sexually transmitted infections. This is a commercially prepared swab and collection container to swab the vaginal canal, and you put the swab then into your container and send it to the lab. The next piece of equipment that is needed is a fairly large cotton swab. This will remove any excessive vaginal secretions prior to your pap smear. There's two techniques that can be used to gather the cervical cells. The first is with a cytology brush and a spatula. The cytology brush collects the endocervical and the spatula collects the exocervical cells. The other device that you can use to collect both those cells at the same time is the cytology broom. The point goes endocervical and you rotate the broom in a clockwise fashion to gather your cells. This container represents the thin prep container that you will put your collection tools in and swirl around to deposit the cervical cells inside the liquid that is in the thin prep container. It's also good to know that there are several sizes of speculums. On the table is a representation of a small, a medium, and a large. So you really want to gather the right size for your patient. And you also want to be able to play with opening and closing these. So really work with this tool prior to inserting it into your patient. You will need two sets of gloves. And you also will need lubricating jelly as you will put this on your gloved finger to do a bimanual exam.
So before we go into the sim lab, let's just return to our case study. So again, how old is our patient? Does anyone remember? So yeah, she's 45 years old. So she certainly fits between that 21 and 65 and that 25 and 65 range. Does she need a pap smear and a pelvic exam today? Yeah, you're correct. She hasn't had one for 6 years and she's not sure of that history. So she certainly would be indicated for an exam today. And do you think she should have co-testing for HPV? So again, you're right. You've been paying attention. HPV co-testing can be done every 5 years. So she could go ahead and have her co-testing done with her PAP and her HPV, and hopefully that will return normal and she'll be set for another 5 years. The references for today's presentation. And if you want to get your items together, we'll be moving into the simulation lab for demonstration and practice time.
All right, guys, we're moving into the sim lab for our demonstration on how to do a pelvic exam. We have our patient undressed, ready on the bed, and our equipment table is all set up. So I think we're ready to go. So Ms. Smith, we're going to do your pelvic exam. Is that okay? All right, I need you just to scooch down the bed a little bit for me. And I'm just going to uncover you here just a little bit. We need to turn our light on so we have good vision into the vaginal canal to see the cervix here in just a moment. We're going to put our gloves on. And the first thing that we're going to do is inspect the vaginal tissues, the external vaginal tissues, before we move internally. And I like to use just a cotton swab to be able to manipulate the vaginal tissues. I always look at the vaginal area like a clock. That way I have a point of documentation like a clock face. So I start at 12 o'clock at the top and look at the mons pubis. I look at the clitoral hood and the clitoris, and I work my way around to the 3, 6, and 9 o'clock positions. And I essentially just look at all of the external tissue to start, the labia majora. If that looks good, I will separate the labia majora and inspect the labia of minora and move inside the vaginal cavity, where I look at the urethra, the Skene's glands and the Bartholin glands. You can also look posteriorly at the posterior fourchettes. So nothing has gone inside, it's all just been a visual inspection to start with. If there's no red areas or erythema or no lesions, then we can move on to more of the internal exam. Again, if I want to check for an STI, I will gather my commercially prepared swab, insert it into the vaginal canal, swab it, it goes in my container, breaks off, and I secure that. The next piece of equipment that I will pick up is my larger cotton swab. Again, I gently open the vaginal tissues, it goes into the vaginal canal, and I'm just going to swab for any excessive vaginal secretion. We're now ready for the pap smear portion of the demonstration. I've chosen a speculum that fits the size of my patient. I do not put any lubricant on it as that can interfere with the cervical cells, but I will run this over under some warm water just to make sure it's comfortable for the patient. So you insert the speculum. Let me tell you how I hold this. So I actually hold the speculum in my right hand. I'm left-handed, so I like to use the tools in my left hand. And so my small finger, my pinky finger, and my ring finger go around the handle. My middle finger and pointer go around the bill of the speculum, and my thumb is what I use as the trigger to open and close it. So the speculum gets inserted in the closed position, goes in at an angle, about 45 degrees, and I'm going to insert it towards the posterior portion of the vaginal pelvis, because if you insert it straight ahead or more anteriorly, you will have pain on the urethra. So I open the vaginal tissue, insert the speculum. As I'm inserting, I'm rotating it so then the handle is down, and you open the speculum. At this point, I can visualize the cervix inside the vaginal canal. I'm going to use my broom to gather my endo and exocervical cells. So after I've done my visual exam of the cervix, I put the point of the broom into the cervical os and I rotate the brush 5 times. The brush comes out and goes into my thin prep container, where it gets swished around about 10 times to ensure all the cells are off the broom. I certainly want to close my speculum prior to bringing it out of the vaginal canal. Turn the speculum and it exits the body. Perfect. So we're now going to finish the exam with an internal exam. You can change gloves for this if you wish. But now is when we need our lubrication. Put it on our finger. And a lot of times I will stand for this just to get a better feel. So Ms. Smith, I'm just going to do an internal exam with my finger. My finger goes vaginally, my pointer finger. And I just feel along the left and the right side of the vaginal cavity for pain or discomfort or tightness. I'm going to push suprapubically above the pubic bone to make sure there's no tenderness. And we are going to check for ovarian tenderness by putting my hand that is not vaginally about the level of the umbilicus to the left side and sweeping it towards the deeper pelvis. And I will repeat that to the right side, trying to capture an ovary between my fingers. So my internal finger is along the left side as I sweep the left side, and move it to the right side as I sweep the right side. At this point, our pelvic exam and pap smear is complete.